My name is Dr. Tim Nicholl, Clinic Director at Maximize Chiropractic. I was recently asked by a member in our office if their parents who have spinal stenosis, if it's safe for them to go under chiropractic care. And today we're going to be reviewing spinal stenosis. In all reality, you need to understand what it is, how it gets to be, what treatment options are out there, and then you can decide what the safest approach is. Spinal stenosis is a condition of the spine, and it affects the internal area of the spinal canal. It most commonly affects the neck, the lower back, and what happens is this canal here or the canal here is affected by either a disc or a bone. So what can happen is if you have an unhealthy spine, the disc can put pressure on the nerve root, or the disc can put pressure on the spinal column. Unless this was caused by a traumatic injury post-car accident, there are generally postural or functional causes to this. What can happen is in a normal, healthy spine, you will have a C-shaped curve in the neck. When you have this C-shaped curve, the weight of your head is distributed evenly over these joints. As your spine starts to become altered in its position, it starts to alter in its shape. As this starts to occur, it limits the mechanics of your spine. What's important to understand though, is that if you are facing stenosis, you may or may not have symptoms. You may have numbness, tingling, reduction in reflexes, muscle mass differences. Well, you first have to understand how chiropractic can improve the health of your spine if it gets here, how it gets here, and how to maintain a healthy and normal spine. Chiropractic can be used in many different references, just like medication. So when we look at stenosis, we want to make sure that chiropractic is an absolute viable and safe opportunity if the area is analyzed appropriately. You've got to look at the x-rays to understand that if your spine is over here where you have damage to the bones, then it's happened to this due to a reason. In my opinion, you need to have a motion study or an x-ray that shows movement within the joints. Whether it's your lower back or your neck, motion studies in chiropractic offices can show where the bones are damaged, how long it's been like this, and what corrective methods are there.